Parliament is currently debating the National Budget Framework paper in various sectors. In acknowledging the achievements of the state, the leader of opposition in government, Ssenyonyi, said there was an effort to build many health centers, but most of these lack drugs to treat patients.
The issues, as we were discussing the budget framework paper, as we continue discussing the budgetary process, we are presenting our alternatives and we are saying, let's deal with the 15% Abuja Declaration pledge so that we can take care of health care. Because you see, once people are healthy, they're even able to now, be creative and make their own money somehow.
There's a hospital next to this place, but you find that every time they go there are no drugs, nothing for using. So you find that even sometimes to access services, you have to be able when you have forked out money.
This, he said, had prompted health workers to refer patients away from the health centers and into private institutions. In return, Ssenyonyi is appealing to Parliament, which has already proposed to increase the budget of the national medical stores to emphasize health care.
Of our budgets will be channeled towards healthcare. To date, that does not happen. Recently, in February of 2023, they renewed this commitment. But that's not happening. It's a far reach. And yet, there is money in this, our country. We lose over 10 trillion shillings per year to corruption. So no one should say there's no money. We just do not put our priorities right.
He also called on the government to put more emphasis on the planned specialized hospital in Lubowa to save the country's expenditure on healthcare for the very vulnerable who have to be taken overseas.
Lubowa Hospital, we have so far injected over 113 billion shillings. And as I speak today, a lot more money keeps going there. But what is there to show for it? Whenever members of parliament try to go there, they are barred from accessing. Why? Because there's nothing there, really. Why do we operate this way? Why do we not take healthcare to be important, and yet it is?
He is also looking to see an improvement in the state of health facilities of first instance, where most patients first report.
And that we fix healthcare, because even you, when you get a challenge, and there's a minister who had a challenge in his constituency, he had to first be taken to the health center of his constituency for first aid. But they could not attend to him because there was not much to attend to him. So you might say that, well, for you, when you are unwell, they'll take you to India and so on. But before you're taken to India, you'll need to first be attended to here locally.
The call came as Ssenyonyi held a medical camp in Naguru in Nakawa division for his constituents, where over 2,000 patients were attended to.
The fathers have left this responsibility to the mothers, and they're the people that you'll find that some mothers, more so in this community, that they are the breadwinner. Yeah, they are responsible for the school fees, for the welfare of the family. And with that need that rose so high, we decided to come in and step in, at least to give them a hand.
According to the health workers at the camp, most patients were treated for malaria, which they say is heavily prevalent there.
Basically, the main cause, people do not want to sleep under mosquito nets. And another thing, people are not aware about the preventive measures of malaria. They are not conversant about what malaria can do to their bodies in case they do not find treatment. So